Good evening, everyone. I'm Dr. Mohammad Sami. I'm the specialist ophthalmologist at Urdu Hospital. First of all, would like to thank the Urdu Life team, my team at Urdu Hospital, for giving me an opportunity to come here and speak about digital eye strain. The digital eye strain itself is self-explanatory. It's the eye strain or the eye problems which people face when excessive use of screens like laptops, mobiles, iPads. Now, we are in a digital era now. Now, everybody is using, screens, right? You take any age group. Even I've seen, people coming, with 2-year-old kids, and they have mobiles in their hands and they are watching some cartoons or something or the other. So everybody is now having gadgets in their hands. Now, as we speak, also everyone is having some kind of gadget. Now, this is not limited to any particular age group, but to everyone now. And it's earlier the screens were basically used for work purposes. But now, with a lot of entertainment and everything available, people are connected to each other with WhatsApp, Facebook, and also the use has increased tremendously. We have been facing a very tough time in Corona, where most of the people, they have been locked up inside their homes, kids not going to school, people working from home, and this has also increased to a lot of increased use of screens. So the cases of digital eye strains have been increasing. Now, first we need to understand what are the symptoms, what you feel when you have digital eye strain. So one of the most common symptoms are heaviness in the eyes, headaches, blurring of vision, dryness in the eyes, and a lot of people, they even complain of pain in their neck and the shoulders because of the bad posture which they attain when they are using screens. Now, many people will complain of poor sleep quality and insomnia. A study in America, they've said that of all the people who are using gadgets, 80% of them, they use these gadgets at least 1 hour before sleep, which is not recommended. You should not be using any kind of screen at least 1 hour before going to sleep. Even televisions you should not be watching, because what happens is all these gadgets, they emit blue light. The blue light actually activates the brain, and then it helps, it becomes difficult for people to sleep. So it's not recommended. Even we are in the habit, the first thing we do when we get up, okay, open the mobile and check WhatsApp message, email. This is also not recommended. You should not be using screens just after, getting up from sleep, because even that causes, worsening of the digital eye strain. Symptoms of digital eye strain vary with the amount of screen usage. The more the screen you use, the more the symptoms and more profound the symptoms will appear. If you're using screens for a very long period of time and you're not taking breaks in between, that's not good. You need to take breaks. Now, to understand what exactly is causing this digital eye strain is, first of all these screens and all, they are emitting blue light. Now, as compared to the normal yellow light or the white light which we have, the blue light is more strenuous to the eyes. It causes more irritation and more strain on the eyes to read or see anything. Like, for example, if you have to read a book, right, and you're reading a book on a paper, you're reading a paper book, you can read maybe 50 pages in one go, for example. But if you're reading the same on the Kindle, on an iPad or something, you will start feeling, irritation or eye strain or, headache. You won't be comfortable even after 20-25 pages. That is because of the blue light which is emitted. One more thing is that there is a lot of glare when we are using the screens. So the glare from the surrounding light which reflects on the screen makes things for us difficult to see, and we then, force our eyes to see. A lot of people, they have, refractive errors. They have some power of, they need glasses, but they are unaware of it and they are forcing their eyes to see. That also actually worsens this digital eye strain. So another factor which we need to take into account is the dry eyes. What happens is, like, when we're using a screen, if you notice, a normal individual who's not using any screens or anything will be, blinking his eyes at least 15 times per minute. But when you're using a screen and all, your blinking rate reduces. When your blinking rate reduces, the tears which are there in front of the eyes, which help to lubricate your eyes, they are not redistributed. So the dry spot starts developing, and then the symptoms of dryness develop. And if not treated well, they can eventually lead to severe dryness and further complications. Like, another thing I spoke about was the back pain and the neck pain which people have who are using a lot of digital. This is because of improper positioning. So you need to position yourself well to avoid all these symptoms. Now, the chances of digital eye strain is more for a person who's using 2 hours of continuous use of without taking breaks. Now the thing comes that, okay, as an ophthalmologist, what am I going to do to find out whether you're really suffering from a digital eye strain or not? First of all, if you are having any symptoms like eye strains, eye pains, redness in the eyes, dryness, headaches, while watching screens, or as a matter of fact, if any other time, you need to visit the ophthalmologist or the optometrist so they can check and see whether you have any refractive error or you need eyeglasses or anything like that. Another thing, we go and see that we examine your eye and see whether you are developing any dry spots which correlate to development of dryness. And if that is there, we need to prescribe some lubricant eye drops and things like that. Now, prevention of digital eye strain. Well, the easiest thing is to avoid screens. Now, technically, this is not possible, So what we can say is minimize the use of screens, right? So minimize it, like at work, if you're using it, fair enough. You just use it at work, and then when you come back home, keep your mobiles, keep your laptops away. Spend time with your family, with your kids, and the kids also, they should, not be watching too much of playing games and Facebook and WhatsApp, and there are now all sorts of games available on this, and everything is available for kids. Kids should also be restricted, and I think it's the duties of the parents that to restrict their usage, let them allow to play other games and all. Outdoor activities are helpful not just for prevention of digital eye strain, but the overall development of the kids also. So this is very important. Now, one thing is, like, I can give you some things, like if suppose you're doing office work, like you have 6 to 7 hours of work on the digital screen, which is very common for people here. So what you can do is, like, after every 2 hours of work, just take a 15 minutes break, avoid the screens, and relax yourself. Another thing is that in between, while you're working those 2 hours, after every 20 minutes, just take a 20-second break and try to look far off at around 20 feet distance to allow the eyes to reaccommodate. This will help to prevent the eye strain. You should always get your eyes checked at least once a year, because sometimes what happens is that you have some refractive error, but you are over-focusing your eye and straining yourself to see, but you're not thinking that, okay, I have an eye problem. I think what you can do is that you can use some, anti-glare screens in front of your computers and all, and you can also use these blue filter glasses to reduce this effect of the blue light. Another thing is very important is the positioning of the computers at your workplace or at your home. Now, the computers should be actually positioned below your eye level. It should not, because it's always comfortable, like if the computer is down, you can see down, it's comfortable, less of your eyes exposed. But if the computer is up, you have to look up and you expose your eyes and see with a staring look, and it causes pain in the neck also. The positioning of the keyboard also should be very appropriate. If you are typing something from the book or anything, or from ledger or something, that should be kept above the level of the keyboard, so that you don't have to move your eyes up and down to see from the book and then type it or do things like that. You should always have a very comfortable chair if you're sitting for long time. And I think that's more than enough, that we should be, limiting our time to exposure to screens. And I think, yeah. So if you all have any questions, you're please free to ask me.
We have one question, Doctor, regarding if the screen protector helps.
You mean the anti-glare screens? Yeah, the anti-glare screens definitely do help, because it reduces the glare. But if you don't want to use an anti-glare screen, best thing is to have a proper lighting in your room. There should be no direct sunlight falling on the screen, so that it causes more glare. So you need to reduce the glare. That's it.
Okay. And for how long it is recommended to play, like for kids, if they want to?
Yeah, actually, that's a very difficult question to answer. But as I told you, you should not use any screen for a very long time, especially for kids. What I recommend is that don't give them for more than 20 minutes at a time. Give them some break, and then you can give them 2-3 times rather than giving them for 2 hours in one stretch. Like if they want to watch some movie or something, don't give them on the screen. Let them try and connect it on a big TV and all, and let them watch from far.
Yeah, I think this is the same question. Are there any protector to avoid the blue light?
Yeah, blue filter glasses are available. I mean, you can buy them, and even if you have prescription glasses, blue filters can be, special lenses are available, and with blue filters is incorporated.
And also another question, what is the cause of dryness in the eyes?
Well, the cause of dryness in the eyes is many. One of them is the use of screens, then air conditioning, and then with age also, and then there's some hormonal factors also, so diabetes. These are all factors which all predispose to dryness in the eyes.
And you have also another question, Doctor. I have dust allergy. What can be done? Dust allergy.
See, dust allergy, for any kind of, as a matter of fact, for any kind of allergy, the best thing is to avoid the allergen. So in your case, you need to avoid dust. This is technically not possible, but still there are drops which can control the allergy. There is no cure. We cannot cure the allergy. We can just control the allergy and give you some drops so that the allergy does not happen. But again, if you stop the medicine, then over a period of time, when you're exposed to dust, you can again have the same symptoms of itching and redness.
The recommended sunglasses. This is out of the topic.
Yeah, the recommended sunglasses are that they should have UV filters. They're UV protected glasses, basically. You should have. I would not go in for any good brands. They all have good protection.
Okay, someone is asking, can you say anything about fake branded sunglasses? Is it still protecting from the sun?
Yeah, of course, it's a fake, but still it has something. So something is better than nothing. That applies, but then it's always recommended to use branded and certified glasses, which have a certificate of UV protection.
And also another question, how to verify blue light protectors?
Verify?
Yeah. Like how to know that this is authentic or it's real?
See, if you're buying from a branded showroom, or with a brand, like, I won't name the brands, but you can buy, and if you sometimes it's not so easy to check, but yes, we can sometimes check that a blue filter is incorporated in that.
Okay. And do you recommend any home remedies for dry eyes?
Home remedies for dry eye. The air conditioning should be not very cold. The draft of air should not be, like, if you're driving or if you are having air conditioning, the draft of air should not come directly on your eyes. It should be away from your face.
Okay. Doctor, can we improve eyesight with food?
Well, actually, like vitamin A is recommended for because it helps in the chemicals which transmit messages to the brain, right? But per se, if your question relates that if I'm taking some diet and that will get rid of the glasses or reduce the number, then unfortunately till now, I mean, we've not come across anything like that. Vitamin A does help in people who have vitamin A deficiency, symptoms of which are difficulty in seeing at night.
Yeah. And any food, can you mention?
Yeah, any green leafy vegetables, carrots and all, they are helpful for eye.
Okay, doctor, shall we ask our last question and see who's the winner?
Yeah, sure. Okay, so now I'm going to ask you a question and let's see who answers first. Which light is harmful for the eyes, right? Rather more harmful for the eyes? The red.
Just before you continue, do you prefer glasses or lenses?
It all depends on the patient. If you're comfortable with contact lenses, you can wear them. If you're not, or if you're having dryness in eyes or irritation or anything, then it's advisable not to wear contact lenses and shift back to glasses. Otherwise, if the contact lenses are suiting you, you're not having any problems, you can wear them, no issues.
Let's go back to the question again.
Okay, so the question was, which kind of light is more harmful to the eyes? The red, the green, blue.
We'll start now and we'll take Rash Mubarak. She answered the first one.
The answer is blue.
Blue? Then it's Abir. Okay, can we take more questions?
Yeah, sure.
Maybe what I understood, that while he's focusing, he gets a headache.
Yeah, see, maybe you have a little refractive error and you're trying to over-accommodate to make things clear. So maybe you need a refraction and we need to see whether you require eyeglasses or not. If you have any questions, you're free to ask. We're still here.
How frequently should we check our eyes?
Annually. At least annually you should be checking your eyes. But in between, if you have any symptoms, you need to check them more frequently, especially if you're a diabetic or something like that.
Yes, 1 minute. What are the symptoms of night blindness?
Okay. Basically, night blindness, as the name indicates, you will have difficulty in seeing at night. Your vision in the night drops. This is typical of vitamin A deficiencies, and sometimes congenital conditions also can cause this. So basically, as the name indicates, night blindness means you'll have difficulty in seeing at night.
Doctor, at what age children can start wearing contact lenses?
Okay, well, I think when the children, it actually depends on the child. Many children can wear at 10 or 12 years. If they are sensible, they can put the lenses inside and take them and take good care. They can use the contact lenses. That's not a problem.
Okay, is it possible that the eyesight improves over a period of time?
Well, actually, that depends on what kind of eyesight you are talking about. Little bit of changes are there, like sometimes when you grow older, your near vision improves because there are changes in the lens, which actually is development of cataract. So yes, it can happen, and over a period of some little bit changes can happen.
Thank you very much, doctor.
Yeah. Thank you for calling me here.
Thank you.
I hope it was useful.